Good evening, everybody. Today is the 9th of November. This is a Moscow City special meeting this evening. If you would all please rise with me, I'll lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. With that, we've got one item on the agenda tonight, and that's consideration of the metrics to evaluate the extension of our public health emergency order 20-03. Gary Reedner is with us via the Zoom. So Gary, I will let you present. We'll start from there.
Thank you, Your Honor. Want to thank everybody for showing up tonight. I'd like to remind everyone, if you could mute your microphone when you're not speaking, it'll help save us bandwidth and get rid of some of the feedback that we will experience tonight. I'll start off with I've got a PowerPoint. I'm working from home. As some of you know, I've been tested positive for COVID. So I come to you from the confines of my house and happy to be here. So Lori, our city clerk, is going to help us move through the PowerPoint. So I'd ask her if she could share her screen at this point. Okay, what we're here to talk about tonight, the council over the last several months has dealt with the question of how do you gauge the metrics by which you evaluate the amended public health emergency order relating to social distancing and facial coverings when social distancing can't be maintained in public places. So we've gone back and forth. I've given several presentations to council, and we've determined that the council wants to see something that is a little more concrete. So we've attempted to put some things together. I've talked to Carol Murley at the Public Health Idaho North Central District. I've talked to Kara and the folks at Gritman, University of Idaho, Moscow School District, so on and so forth. So hopefully we've got some information for the council to take a look at tonight. So if you could advance, Lori. This is just the heading of the amended public health emergency order. It's been in place since midnight on July 1st of 2020. It's been extended twice by the city council through a resolution. What it essentially says is that when you are in a public place that you must maintain social distancing, and you have to wear a facial covering in areas that you can't maintain social distancing, and that facial covering shall cover your mouth, nose, and will be made of cloth or some other material that will help to provide some protection against spread of COVID-19. Next slide, please. Okay, this is the 7-day moving average of confirmed COVID cases in Latock County, updated just today. As you can see, within the last couple of days, 7 days, we've seen a tremendous spike. In fact, if you were motoring around Moscow today and saw some of the lineups for COVID testing at the Gritman facility, it was lined up 20 cars deep. So we definitely are seeing at least anecdotal spread. Next slide, please. This is the actual number. The bars represent the actual counts. And as you can see, that dotted red line is the 7-day moving average. The CDC, everyone uses a 7-day moving average to take out some of the fluctuations, so you get more of an accurate estimate of where we are. So that's where we are as of today. Next slide, please. Okay, the facts as I know them, on November 6th, we had just over 3,000 cases confirmed in Public Health Idaho North Central District's 5-county district. It only took 17 days to increase from 2,000 cases to 3,000 cases district-wide. As of today, November 9th, there were 61 new cases confirmed in Latock County, bringing the total number of confirmed cases to 1,184. Next slide, please. North Central Health District came up with a tool back in August to try and gauge and assess where the district's health was in applying different methods of dealing with the COVID outbreak. So as you can see, the thermometer to the right of this, at least to my right, on this graph shows that you have minimum in the green, moderate, high, and critical. Right now, the Public Health Board has determined that Nez Perce County and Latock County are both in the moderate category. So if you look at the descriptors on the left, it explains exactly what the district is after. Carol Murley is with us here today, and she can certainly chime in if necessary at the end of this presentation, or if she feels that she can help add something to my presentation, I certainly welcome her to do that. So if you look into consideration, some of the things that we looked at in determining, are there some metrics we can use and how would we use those? Input from hospital partners was huge. You'll see that in the presentation tonight. How quickly you can get turnaround for COVID-19 testing, including positivity rate, and how long it takes to get a test result. How much PPE do we have? What is our epidemiological investigation capacity? Contact tracing, that sort of thing. COVID-related hospitalization and deaths. Fortunately, we've had only one death in Latock County thus far, but we've seen our hospitalizations on the rise. And then surveillance of emergency department visits with COVID-like symptoms. So those are the basics. So let's go into where we are today. Next slide, please. So in looking at the data tool, excuse me, if you're in a minimal risk category, if you have daily cases of 1 or less per 10,000 population, you are in the minimal risk category. We have not been in the minimal risk category for new daily cases, I believe, since August. Right now, I believe this weekend, there were 61 new COVID confirmed cases in Latock County. That was 3 days worth of reporting, so that would have been 12 cases versus 61. Then you have the number of confirmed COVID-19 admissions for 7 days, 0 to 5. I believe, if I'm correct, Carol, that was the factor that pushed the health board to push us to the moderate category. And lastly, that you can get test results in 1 to 4 days, which we also meet. So we were in the green category, even though we far exceeded the new daily cases, but as long as our hospitalizations were down, then we still maintained that overall green category. And when those hospitalizations started to rise, we were placed in the moderate category. Go to the next slide, please. The next stage, which is the moderate risk category, it was interesting because they say, okay, if you're in the green category, you're starting to see a rise, you need to look at the next level and what measures can you take to try and moderate the outbreak. So the first one that you see at the top of the list on the right under mitigation strategies, support municipality efforts to require the wearing of face coverings while in public. Encourage event coordinators to limit events and social gatherings to no more than 50 people. The governor has done that by moving us back into stage 3 of Idaho rebounds. Encourage vulnerable populations to take extra precautions. That has also been done. Congregate living facilities to implement strict health policies. That has also been done in stage 3. It is a requirement to wear masks in assisted living facilities. And then schools should implement the yellow phase of return to school plan. So one more, Lori. So in layman's terms, using that assessment tool for our district to be placed in the middle risk category, they must meet the three following criteria. Based on a 7-day moving average, new daily cases must be less than 1 case per 10,000 population. Again, for Latock County, that would be 4 or fewer new daily cases. Second, based on a 7-day moving average, the number of confirmed COVID-19 hospital admissions district-wide must be within the range of 0 to 5. And 3, test results must be reported out in 1 to 4 days. And we clearly meet the number 3 at this point. Okay, move on. Okay, the proposal that you see in the memo that I've attached is to build on the good work of Public Health Idaho North Central District by utilizing that regional data tool, which we are already familiar with when the council is evaluating the continuation, extension, or termination of the amended public health emergency order. So the idea is if we are trying to maintain the minimal risk category, that all 3 of those risk factors should be in the green for a period of 3 consecutive weeks. If that happens, the council could then consider whether to move back into a voluntary or advisory, excuse me. Okay. And the 3 weeks is recommended because of the accepted 2-week incubation period of the COVID-19 virus. And again, this is just a recommendation, and I would invite our partners to talk about it at the end of this presentation. Move on, please, Lori. As is contained in the memo, there are other factors to be considered that are a little bit outside of our purview here in Latock County. The first is the governor's determination of where we are in the stage 4 of the Idaho Rebounds Plan. We are not in stage 4 now, we're in stage 3, having been called back about 2 weeks ago. So we are no longer in the least restrictive stage, we are in the 3rd stage. So again, the council should consider whether, in the opinion of the governor, the state is in a condition to be placed in stage 4. Next, please. Additional factors. I've been talking to Carol at Public Health a lot for the last several months, and we have partners, institutional partners that we need to take into consideration. I would request the council to take into consideration in making these decisions. Number 1, Latock County. Latock County has the EOC. They're responsible for the balance of Latock County. And they've been partners throughout this situation. Griffin Medical Center has been working hand in glove with the city, the EOC, as well as the University of Idaho and Moscow School District throughout this pandemic. And they have some good medical opinions to share. The University of Idaho has implemented some pretty outstanding policies and strategies for testing, surveillance testing, to moderate the effect of COVID-19. Moscow School District has gone to a hybrid school week, have put a lot of policies in effect, which are built upon the social distancing mask mandate. And in looking at how they are moving forward, we will want to consult with those partners as the council moves forward with their assessing their metrics. Next, please. Well, the next huge factor is one that we don't have a ton of control over, and that is that Whitman County, just 8 miles, well, actually, they're our western border, but the city of Pullman is less than 8 miles away, and they've gone through some fairly large increases in COVID-19 as well. They have a different tool that they use for assessing the risk and where they are in Whitman County. However, we can utilize their data, apply the public health assessment tool to Whitman County's numbers, and determine whether or not we are at risk or not at risk. So I would say that those additional factors should be considered as the council makes any decision to move forward with changing the mask mandate. Next, please. Okay, with that, we have representatives from our institutional partners here. Carol's here, Gritman Medical Center, Kara Best, John Brown, and we have
Dr. Garrett. We've got Dr. Garrett as well.
Dr. Garrett, Nick Garrett's here as well. Tony Broyles was going to be with us from the University of Idaho, and Greg Bailey, Dr. Greg Bailey, the superintendent of Moscow School District. So I would ask the council, ask them for their opinions. I sent out letters that were sent us by Dr. Brown and Dr. Garrett. Distributed those to council this afternoon. So hope you've had a chance to read those. And I would stand for any questions either before or after you hear from these experts.
Well, Gary, a few comments that I'd like to say here is we've been going through this journey with the COVID-19 here in our fine city. And we've talked a lot about this. We have citizens, of course, that are very, very interested in, someday when would the end game with this be? What kind of a matrix or what kind of a criteria would we have to be able to change the status that we're at? And that is exactly why we're having this meeting tonight, so that we can discuss those things. And with us here, we have a wealth of individuals, expertise that I always like to look at. And of course, that is our medical field. And of course, Carol Morley is with us from the health department. So I'd like to hear from her. I'd like to hear from Dr. Brown, who's the chief medical officer at Gritman, as well as Dr. Garrett, who is the Moscow Emergency Physicians chief, I guess, for leader, for lack of a better word. We've also got U of I representative here I want to talk to, as well as Dr. Bailey from the school district. So with that being said, Carol, I'd like to start with you. And we're looking at a matrix so that everybody can see those matrices. And right now, our matrices are not good. We all know that. The numbers are high. And this is not about eliminating this mask mandate today, because clearly that would be irresponsible of us to do. But we need to have something in the future for folks to shoot for. So I'd like you to talk for a few minutes, Carol, if you would.
Thank you, Your Honor, and members of the council. Thank you for allowing me to be here tonight with you all. So you are right, the numbers are growing and changing, and not just in Latock County, but in our 5 counties altogether. We have been truly shocked at the growth that we've seen over just the last few weeks. And for us to have 250 new cases, granted over the weekend, but that's a huge increase for us. Not all of those in Latock County, as Gary mentioned, but in our district as a total. So the Board of Health meets routinely as well. We developed this tool back in whenever it was developed. It seems like a long time ago now, but the time kind of just rolls all together. But it's a fluid document as well. So if we have noticed some ebbs and flows, some stalls, some in our decision making as a Board of Health as well, with the way the tool was designed, the metrics that we were using. So as I've had conversations with Gary as well, it's like if there's a better way for public health to help represent the data, our Board of Health is willing to take that on and look at representing it differently as well. We did choose initially that all 3 of those categories needed to be moving in the wrong direction in order for us to move our colors as such. And maybe we've chosen the wrong indicators, but for now, that's what we are sticking with, just so we can watch some trends and the data as it moves between our weekly time markets metrics. So Latock County actually has been, hanging at 11 to 15 to 17 cases a week. And that's a little higher than normal, but the other counties that we have just jumped into the what we call a red category for their population base. So it is moving in the not the right direction to be making less restrictive changes. Public health doesn't feel. The Board of Health just a week ago did move Latock and Nez Perce into moderate risk categories. As Gary mentioned, they were kind of coinciding with the governor's move to back to stage 3. And as you know, all of this is political and charged with lots of emotion as we look at moving the colors in our 5 counties. We also are working on a strategy to show data by zip code, thinking that will be a better tool for you all making decisions, we all making decisions, just because the counties are very big. And we have some large cities in a few of our counties, and the rest of those little places still count. But it's important that they know their data isn't all just focused in Moscow, but the majority is. So of those last week, the 1,109 cases in Latock County, 910 of them were actually in the zip code of Moscow. So that might give a different perspective also, in that maybe, the thought that maybe Latock County is very large and maybe a lot of those numbers are not in the city, but 910 out of the 1,100 have been. So that perspective that most of those cases have been focused right there in Moscow. So Your Honor, I'll stop at this moment and let some of our medical experts move into this discussion and answer questions as you may have them.
One thing before we let you go, Carol, you mentioned we're kind of in Latock County here in the yellow zone, and your other counties are in red zones. Could you tell us what the difference is, why we're there in red and we are not?
I'm sorry, I misspoke, I'm sure. They moved into a category in the bar on red, meaning their cases per 10,000 population were higher than expected, whereas Latock counties have continued to be in that moderate area. Many of our little counties are still actually in the overall green category,
okay,
based upon some of the input, thoughts, flavor of the county commissioners that are in those little counties. So they had not last week or 2 weeks ago when the board met, had moved out of green. Now most of those counties are showing even larger case increases than Latock County. So we'll have that discussion at our Board of Health meeting on Thursday again.
Well, my question was, why would that difference be, is what I was trying to lead to ask you.
I'm sorry, it's truly the number of cases per week based upon 10,000 population. So when we have little Lewis County that only has a population of 3,000 people, and they had on average 3.7 cases per week last week. Per day of last week, it puts them in their population rate into a higher risk category.
Okay, thank you, Carol. Somebody may come back and ask you some more questions. Council very well may. With that, I'd like to move on I'd like to hear from Dr. Brown, the Chief Medical Officer at Gritman. We could hear from him because we did receive a letter from him. Dr. Brown, would you like to speak for a few minutes to us here?
Thank you, Your Honor. Can everybody hear me okay?
Yes.
Okay. As most of you probably know me, I've been a provider in Moscow since 1998 and the chief medical officer for the last 3 years. And I would like to commend you all for your political backbone in doing this mask order. I know it was a very difficult thing probably to maintain, but it was the right thing to do. And we're starting to see some of the fruits of that. In the fact that we have fewer deaths and we're able to control our positivity rate a little bit better than some of our surrounding communities. And there's no way to be 100% certain that it is the masks that are helping to contribute to that, but there is a lot of data to support the thinking that is the case. For those of you who follow the literature, about a week and a half ago, the New England Journal of Medicine put out a review that looked at the various mask data and showed that one of the things that helps decrease your fatality rate is the use of masks, because the amount of virus that a person is inoculated with seems to correlate pretty directly with how severe their case is going to be. And so even though masks are not a 100% solution, they decrease both the exposure, but also the inoculum that a person will get when they are around people who are masked. So I would strongly commend you all for doing that and urge you to continue. I do think that the measures that you're proposing for the discontinuation of the mandatory mask rules seem very rational to me, and I would support them. I think Dr. Garrett is going to talk to you a little bit about the burden that the caseload is putting on our medical resources. Gritman has been able to weather this relatively well, but nonetheless, we still have a large number of personnel who are ill and having to isolate, and our ability to refer patients to specialty care has been greatly made more difficult by the increase in COVID cases, and that's only probably going to get worse. So I think that Moscow is doing a great example, and I hope that other communities in Idaho will mirror what we're doing here, and I'm open to answer any questions that you all might have on this or any other topic.
Okay, Dr. Brown, thank you very much, and we may get back to you with questions. With that, I'd like to lead right into Dr. Garrett, who's part of the Moscow Emergency Physicians Group. Dr. Garrett, would you like to add some comments, sir? Because we received a letter from you as well.
Sure. Thank you, Your Honor. I agree 100% with really everything that Dr. Brown has said. I've read the recent data that the New England Journal has put out, and it is pretty emphatic that masks are our easiest and cheapest method for trying to control this virus without going to extreme lockdowns. One of the things I find concerning from a state level, specifically to the mask mandate, is that only when we get to a risk level of high, which is effectively daily hospitalizations district-wide of 10 or more, which would, at that level, would most assuredly begin to really strain our healthcare system, do they recommend potentially considering face coverings and masks? And I think we've seen in our small part of the world that masks are easy, they're cheap. You can continue to operate businesses while wearing them, and it's one of the last things we probably should remove from some of our mandates. We have seen in the emergency department over the last 2 to 3 weeks, and really over the last 6 weeks, but specifically the last 2 or 3 weeks, time for transfer of critically ill patients is going up. Kootenai, Sacred Heart, and St. Joe's have been at or near capacity for many weeks, and there are certain things, procedures, and interventions that we simply do not have the capability to do at Gritman. And so when we're spending 6, 8, 12 hours trying to get patients transferred because of their caseload of COVID, we begin to see an increase in morbidity on our patients and our community here in Moscow. So I support continuing the face covering mandate for as long as necessary, and I think the metrics that you guys have began to build on are reasonable and prudent at this point. So that's how I feel.
Thank you, Dr. Garrett. Somebody may have a question for you as we go along. I know we've got Kara Best out there as well with Gritman, the CEO. Kara, do you have anything you'd like to add besides what the two doctors have said?
I don't have anything to add, but we're happy. I have Connie Osborne, our Chief Quality Officer, with me, so we're happy to answer any questions from the City Council or you, Mayor, if you need any other information. Okay,
thank you very much. With that, one of our other partners out there, University of Idaho, has done an outstanding job this fall. We have Tony Broyles with us this evening. Tony, would you like to add what the university is doing and your folks' point of view as the partnerships that we have?
Absolutely. Thank you, Mayor Lambert and council members. We're part of the reason why we can meet that third bullet of providing responsive testing in 1 to 4 days, and are pleased with the partnership with Gritman Medical Center to be able to do that. We think that's a distinct advantage for our community, and However, masking is also a distinct advantage for our community. They go hand in hand. It's not one over the other. And in looking at the metrics that are being proposed, we're in favor of those metrics. We would offer that looking at the amount of testing to be done, though, not wanting to look at a low number of cases, but we're a low number of cases because we're not testing. That doesn't actually speak to what is going on in our community. The University of Idaho is a significant portion of Carroll's numbers for the county and for Moscow. But that is because as of today, we've conducted close to 19,000 tests. And so we are actively testing and then isolating positives and doing quarantine activities. So we just feel that the testing is an important component, and that when we, as the university, we've been doing routine surveillance testing. So even after doing a second full-scale retest of our students, we've done close to 1,000 surveillance tests a week, also for the last 3 weeks. When we go into winter break, we won't be doing as much surveillance testing because our students won't be in class and some of them won't be here. So that could very much affect that the daily case rate drops because we're not actively testing. But that is not an indicator that our spread is less in our community. It's an indicator that the university is testing less of their population. And we do intend to do a full-scale retest again in January at the start of the semester. So that will be 3 full tests of our community, campus community, within about a 6-month window. And so we are absolutely in favor of the mask mandate. The university has no intention of lifting our mask mandate, and we feel it's in partnership with looking at the testing and the masking, and we would like to see masking be the very last protocol that the city eliminates as they're thinking about how best for the community to proceed. And I'd be happy to take any questions on our testing or anything else we have going on at the university.
Thank you, Tony. And those test numbers that the University of Idaho has done has really been very, very impressive this fall, and the strong stance that President Green and his team has done has been really tremendous in my view. So we may get back to you with questions. With that, I'm going to go on to another one of our partners. Dr. Greg Bailey, a superintendent of Moscow School District, is with us this evening. Dr. Bailey, would you like to add some remarks, sir?
Well, sure. You can hear me fine?
Yes.
Okay, good. Well, first I want to thank you, Mayor Lambert, for your help and your support for our community, as well as the City Council. I also want to tell you how grateful we are as a school district to have Carol on our side. She works days and nights to help us out to do investigations, so we really appreciate that. As well as Gritman has been great partners as well. And U of I has also helped us out in numerous ways. And that has kept our kids in the school, not as far as we want, fully in school, but the hybrid is working. I would tell you the one thing that I really feel after watching all this and doing the investigations as well is that the mask wearing is the biggest thing that is helping us right now. We've had, I think we're around 14, 15 cases of occurrences where someone was test positive. We've only had one transmission, and that was a person, actually an adult, that wasn't wearing their mask to the level that we wanted them to. So that's extremely, we feel, out of 2,400 students and about 300 employees, that is a huge success in my feeling. we figure probably the last thing that will go away from our school district is the mask wearing. A lot of schools are not wearing masks or aren't required to, and they're having more and more cases than we have. So we appreciate wearing the masks, and it really has helped us a lot with the community, with the city requiring it. That has helped a lot. And I'll tell you, even our kindergartners are handling wearing a mask with no problem. We have not had any case. I've only had one parent complaint in wearing masks, and that's it. And that's pretty impressive for the city of Moscow. And so I can answer any questions you want, but we really appreciate the mask ordinance as you have it now.
Thank you, Dr. Bailey. And one of the counselors may very well have a question for you, as well as others. And we've got one other person, another one of our area partners is Kathy LaFortune, a county commissioner. Kathy, are you with us this evening? Would you like to make some comments from the county's point of view?
Just that we appreciate Moscow's leadership on the mask and social distancing mandate. Of course, all the Latock County facilities are within the city of Moscow, and we comply with the mandate as part of that. And I think we were able to pull off a very successful recent election because of that mandate. Of course, we're sort of waiting with bated breath to see if there's any increase in cases that could be traced to the polling places, and we're hoping not. As you know, we're in a unique situation where the only area that we really have any jurisdiction over is the unincorporated portions of Latock County, where case rates are very low. So we're, of course, watching what those other metrics are, the hospitalizations and the test turnaround. But we appreciate the leadership from Moscow. And I read Gary's memo thoroughly right before this meeting, and I think the metrics that you're using are very easy to understand and definitely align very closely with what public health is recommending. So we appreciate that as well. And I appreciate living in this district, especially after talking with my daughter who lives in eastern Idaho right now.
Well, thank you, Kathy, very much. I don't think I missed anybody that zoomed in with us. I know we've got a number of counselors on there, but with that, we do have a few folks out here in our audience, and so I'm going to allow some of those folks to come up and give us their point of view if they'd like. And we'll give you 3 minutes, so state your name and please come on up.
Kelly Zachariason, Moscow, Idaho. I actually didn't prepare anything. I just had a few questions. I'm not sure if they'd be best answered by Tony from the university or Carol or maybe our representatives from Gritman. But I was wondering what percentage of cases in Latock County are symptomatic when tested and what the follow-up testing process is in our county right now. I'm not really sure what that is. So if you could clarify, that would be wonderful. Thank you.
I guess I would go to Carol, I would think. Or Carol, or do you have a recommendation for someone else?
Well, I can start and then send this to the hospital who might know more than I. So the symptomatic, we have anecdotal information from public health in the investigations we're doing that most, and I don't have a percentage, but most of the people that we talk to have had symptoms at some point. So, I mean, that's truly anecdotal. As far as the retesting, the CDC recommendations are not for retesting those that have already had a positive test result, because that positivity will remain in your system at least for 3 months. And Dr. Garrett, you may help us with that science if you know more on that. But as far as I know, public health is not recommending retesting of those that have already been positive.
Okay, Dr. Garrett, do you have anything that you would like to add to that, sir?
Yes, sir. I agree with the not testing. I've seen patients that have come in for other things or have come in a second time that have been having symptoms and they've tested positive, but they were positive a month, 2 months before. We have very good data around the world to show that you will continue to shed the virus from a testing perspective for up to or beyond 3 months, although you may not be able to transmit the virus beyond the initial 10 to 14 days post symptoms. So the retesting seems like a little bit potentially of a waste of resources for patients that have already contracted the virus.
Thank you, Dr. Garrett. Okay. Would somebody else like to get up and speak?
This is Connie from Gritman as well, and the question surrounding are people mostly symptomatic when they come to test. Really, besides the University of Idaho that mandated for their students and such, probably most of those, I would say, came in through getting tested because they were symptomatic. Right now with bringing on the flu season and everyone's starting to be inside more, we are seeing the congestion, the runny nose, all those kind of things that could be any virus of types, but also are the same that COVID has. So we're seeing more symptomatic, I would say.
Okay, thank you. Do I have anybody out here like to get up and speak? If you do, come on up, state your name, I'll give you 3 minutes.
Danny Bradley. Oh yeah, I just had an informational question. Where would I go online to find just a document that breaks down the metrics?
Okay, Gary, so I guess that's something we'll be putting on our website, would that be correct? Once we make a decision, and we haven't really made a decision yet,
Okay.
Daniel, so I think it's going to depend on what the council ends up doing this evening.
It's probably on the city website then,
Yep.
most
But
likely.
you'll hear more about that as we go through the
Great,
evening.
thanks.
There are the metrics that Carol spoke about for the public health district are on your website right now, what you have in place. Is that correct, Carol?
That is correct. And that website is idahopublichealth.com, all one word, .com.
Okay, thank you. Carol? Others like to speak before I turn it over to council? Come on up, please. State your name.
Shyla Paradis. I just would like to say something coming from the perspective of a mother who has 2 children in the school district. And we recently went online only because my boys have been struggling with being discriminated against because of the mask that we chose for them to wear did not fit what within the parameters of what the principals thought and the superintendent thought was appropriate. And all the rules said in the handbook were that it was to be 2 layers of fabric or paper or cloth. And it does not state thread count. It does not state cloth type. And my son in first grade at West Park, he was asked the compromise they gave us for a while to wear the mask that we allowed him to, that we sent him to school with. He was asked to social distance from everybody at all times. His desk was moved to the opposite end of the classroom. His locker was moved from everybody else, and he was asked to be at the back of the line at all times. And this right here, like these types of emotional and psychological things that are not, that our children should not be going through this, they should just be going to school like normal. And we shouldn't be worrying about this with this mask thing, because I don't feel like it's doing any good. People are going to get sick anyways. This time of year, people get sick anyways. And I don't feel like it's doing any good other than hurting everybody else. We can't even go to the public library to get required school materials without being hassled about not wearing our masks, because we, for medical reasons, do not want to even be wearing a mask. And I don't feel like this is healthy for our community. And I didn't come prepared at all to speak actually, but I just wanted to somehow express to you how I'm feeling from a parent perspective about all of this. I feel like wearing a mask should be a choice for everybody in this community. It should not be something that should be required. I try to be respectful of other people. I understand there are people that are more at risk. Not only, I mean, even with just the flu, people can be at risk with. It doesn't matter what it is, if it's COVID, the flu, the common cold, somebody who's going through chemotherapy. I mean, they could be susceptible to even a common cold. And I understand people like that need to take greater precautions. But those of us who are healthy and don't need to take those precautions for ourselves, I feel like it should be a choice for everybody regardless. And our children should not be pulled into this, and we should be able to send them to school and have a normal education without having to go through all this.
Your time's up, miss. Thank you.
Thank you.
Well, one of the things I'll say, ladies and gentlemen, that we all should be able to agree on, this is not normal times, what we're going through. This is a unique situation for not only us here in Moscow or our wonderful state of Idaho, but this entire United States and the world. And we will get through it together. And there are going to be things, I said this I don't know how many times, not everybody likes to wear a mask. I don't particularly like to wear a mask, but I will, and I'll continue to wear one until we're by this thing, because I think it is the right thing to do for our neighbors, because I may very well be asymptomatic and a carrier of this, and if I could prevent it, and if I do in fact have that, and if I can prevent giving it to someone, I think that would be a very big deal. And one other little thing I wanted to say, folks, is that we're doing this for the greater good of our community, not any type of a thing or a power play by this council, or clearly not this mayor or any one of these folks from our wonderful community that have been talking about this. This is something that we very much respect this community and like to hear from all. So, okay, is there anybody else that'd like to come up and speak? Okay, with that, I'm going to turn it over to council. So, who would like to speak first?
I can go.
All right.
Yeah, just a couple points of clarification that Tony Broyles opened the lid on was the consideration of metrics as they impact with statistics. And so one of them is how many tests can Gritman accommodate during a day? The university has a great system set up, but how is Gritman doing in the number of tests they can do? And two, if we're looking at the number of positive cases per capita, if we're only testing people who are symptomatic, we'll be biasing the number of people who might be positive but asymptomatic if you aren't testing the asymptomatic folks. And I think that's an aspect, a facet that we have to think about as we look at these metrics in terms of cases per 10,000. Are we getting all the cases or just the ones who are already ill? And given that, how many tests can Gritman do for the people who are out in Moscow and within the county, not just the university?
So that's a question for Gritman. So Kara, I guess that'd be a question for you and your team.
But I'm going to answer that. This is Connie. So unlike what we did up at the university where we're testing the non-symptomatic, so that means we had quite a group of Gritman nurses and staff that moved that number of students through, and those were typically your asymptomatic students. If they were symptomatic, we would like them to go through our drive-through, so that decreases the potential spread of the disease. So when you talk about the asymptomatic, we also have been testing those individuals that have been exposed to a positive patient or a positive individual. So even though they are themselves asymptomatic, if they've been exposed and they wait a long enough time to assume they would have what we call a viral load. And that's usually typically past about 5 days. So about the 6th day or so, you can see if there's enough of a viral load to test. And that's what we're seeing in our potentially exposed individuals that have been around or within the 6 feet, unmasked, or even one person masked, and that's the folks that we're seeing that are asymptomatic. So that testing is still being done.
So how many can Gritman handle a day?
Yeah. Art, can I speak to that, please?
Yes, sir.
So the Gritman and the U of I lab are a partnership and together, and it's not just when we break for school, the lab isn't going down. All of our staff and machines and everything will stay operational. So as many swabs as the Gritman nursing staff can do, the part of the lab that Gritman helps operate and the part of the lab where we do the analysis will stay functioning. So we committed to the state that once we were up and operational, that we would add capacity to the state resources for testing and keep it open until it was deemed no longer necessary. So as far as capacity, there's no issues on our end or the partnership with Gritman. Connie was very articulate in saying, though, we've been using our gym and doing hundreds and hundreds a day, sometimes 1,000 in a day. It would be the swabbing portion. And if you were doing asymptomatic along with symptomatic.
Thank you.
May I add something, Your Honor?
Yes, you may.
Yeah, just to comment on widespread testing of asymptomatic people is not a horrible idea, but it does have some problems associated with it. One is that, as Dr. Garrett indicated, you can detect traces of the viral RNA for months after an infection. So if you do a test on someone without any symptoms and they turn out positive, what does that mean? It could mean that they had it 3 months ago. And so it shouldn't really be considered in your trying to assess what's happening in your community right now. Also, when you do any medical test, the population you do it on helps you understand what a positive and negative test means. If you do a screening test on a population that you don't expect to have a lot of cases, then almost all your positives are going to be false positives. If you, in this case, when you test people who have symptoms, you have a much higher expectation that you will, if a person is positive, that they're going to, if the person has a positive test, that it actually represents a true positive. And so you have greater confidence in your test results if you test a population that you suspect is going to happen, or it's a symptomatic population. So I don't, even though it's understandable to want to try and capture a better picture of what's going on in the community, the technology that we have is not as useful as we might hope it would be for that purpose. So I just wanted to introduce those ideas.
Thank you, Dr. Brown. Okay, how about some other counselors out there? Gina, I see your hand up.
Hello, everyone. I have to say that I have listened to this discussion now for a little over an hour, and I can't think of a better team to pull together to get us through this pandemic than the group in front of us. I'm incredibly proud of us, and I think our numbers are low because we pulled together and we needed to solve, or at least get our community through this. And 19,000 tests is insane. Thank you, U of I. Thank you, Latock County. Thank you, medical community. Look at what we've accomplished. I very much like the recommendations. I hear Art's question about the symptomatic. I think that, as Dr. Brown pointed out, we are learning about this as we go. Unfortunately, we're all becoming experts in COVID-19, or how to not catch it in this time. I think 3 consecutive weeks at a minimal risk category is a very, very good recommendation because of the 14-day window that we've been kind of told from day one. I think masking is a minimum, and I don't think it's a lot to ask. I know that it isn't the very first thing we want to put on in the morning, but it's important that we do. So I think that the application of the Idaho tool on the Washington numbers, I question, and I'm not saying it's a bad idea, I just question how that becomes apples and apples and not apples and oranges. But other than that, I think this idea to kind of set these metrics up as a framework is a very good thing. And then, continuing to learn. So I don't know if anybody can answer that Washington data and apples to oranges thing, but other than that, I think we are really doing a great job. And I'm just thrilled that this group of people is in some degree of control of this for us. And I appreciate everybody's efforts.
Thank you, Gina. I'm going to go to Brandy now.
So one of my questions, actually, Gina led into it quite well, is probably for Carol. How easy would it be for you to determine those same 3 metrics that you're using here in your district for Whitman County?
Thank you, Councilwoman. I think I'd need to get together with Gary and we just hash this out, just, run those numbers. I need to get those numbers first. And I think you all have been tracking probably Whitman County closer than I have just because I've been busy in Idaho. But I think we could present something back to you just to show you whether or not it's apples and apples or apples and oranges, if we can get that level. So I think it would just take a work session and we could perk that out, Gary.
So the information is discoverable, it's available.
I'm sure it is. We just need to see if it's discoverable in the population framework that we're using. And if not, how we can convert it and making sure that it still is applicable in reference to the Idaho numbers, data.
I would agree.
Okay, thank you, Carol and Gary. Ann, how about you? Yeah, I see you up there smiling at us. Go to you.
I wanted to pass it to Brandy. I think she had another question, and then I had some.
Brandy,
Okay.
you got something else you wanted to say?
I just had a couple, I had a question for maybe Connie, but you were talking about when someone does test positive and then there's a determination made about who of their contacts also needs to be tested. You said something about mask wearing being a part of that sort of investigation. What does that mean to you when you are looking into a positive person, or maybe this is a question for Carol, who of their contacts need to be traced? How does the mask wearing work into that?
Okay.
So one of the issues looking at that is how long a time did the individual spend? So obviously longer, as Dr. Brown had talked about that, the longer you have spent time with that person, whether you have a mask on or not, increases the likelihood. Now, if you're masked and I'm masked and it's less than 15 minutes, it's not considered an exposure because you're both protected. Now, if I take mine off and you have yours on, but I'm the infected person, I'm not stopping the droplets from going throughout the air and into the room or on surfaces. So depending on the amount of time we're spending, just increases that. Now the CDC put out some information not too long ago that they did a study in prisons and found that if you had an accumulative of 15 minutes or more, so 5 minutes at a time, and that increased over the period of 24 hours, it increased your likelihood of contracting COVID as well. But I'm sure Dr. Garrett or Dr. Brown can speak better to that.
Okay, how about Dr. Brown or Dr. Garrett, either one of you? Would you like to comment on that, please?
Well, yes, the prison study is controversial because prisons are a special environment, poor air circulation, all indoors, people crammed together, not very great hygiene, not very good cleaning of surfaces. And so we're hoping that that study does not have widespread applicability, and indeed is an area of controversy and appeal right now. So I think that the main thing to get back to the original question is when we do tracing at the hospital to try and decide if staff members or patients have been put at risk, we do the things that Connie was talking about. Who is masked? What's the distance? What's the environment? What's the length of time exposed? And basically those numbers are all derived directly from the CDC recommendations, which are available. And Connie pointed to that one area of controversy. In the past, it was 15 minutes was kind of the magic number within 6 feet. But there's some question given that prison study of whether that is additive throughout the day. And that obviously has repercussions for us because we have people who are going to be testing folks, for a 6-8 hour shift. And it'd be pretty easy to stack up your 15 minutes very quickly if you're doing that, and so we're still kind of working through making sure that everybody is safe and whatnot. But hopefully, I guess I would recommend that y'all not worry about that aspect right now, because as I pointed out, that's a controversial study.
But it does sound like, though, for the cases where it's just 2 people, less than 15 minutes, the difference between concern or not concern could be if those 2 people were wearing masks or not. Is that what I'm hearing?
That's correct.
Okay, Ann, I'll go to you unless you.
Thank you, Mr. Mayor. Carol, I wanted to commend you and all of your team for all the work that you've done. I thought it was really interesting that you mentioned being able to break it out by zip code, because I think that would be really helpful in kind of understanding the full landscape. Do you have a timeline for when that data will be available?
Our Board of Health will be discussing that on Thursday. So we're hoping that we'll release that as soon after Thursday as we can. Part of the stall has been getting to a large enough number that the data isn't discoverable, that it can't truly be pointed back to these little communities anyway that says, oh, 2 cases, I know who those were. So the confidentiality has been very important for us, and that's why it's taken us a little while to get to that zip code level of data, but we think we're there now, and releasing it by zip code. So the Board of Health will look at this on Thursday.
Great, thank you. And I remember that being a component, that confidentiality piece.
Yeah, and I seen that Kathy LaFortune had her hand up. She might have had something to add to that. Did you have something to add to that, Kathy?
Yeah, the one thought that, and this is something we discussed with Carol before, is just even having it broken out 83843 and then other than 83843 would be helpful, I think, for Latock County. And then I think for people who are savvy with the data that's on the public health website, you could look at the age range 83843 and pretty much easily trace it back to, this is mostly university spread at this point in time. But I think the thing that's important is there's this feeling of immunity out in some of the outlying communities within Latock County, and they're not immune. They are some of those cases. And if you look at the data and pull it apart like I do every single day, it's something I don't look forward to doing every day at 3:00, but I do it anyway. And my concern is that we're seeing, besides the university population, we are seeing rises in cases in the age ranges that are much more vulnerable. And that concerns me a lot.
One thing that Carol had said earlier, out of 1,100 cases, 900 were here in Moscow, so that roughly is about 82% of all cases with that matrix that Carol gave us earlier in the conversation. Ann, did you have some more you wanted to?
Yeah, just a comment that when looking at what's being proposed, I really, I like those metrics, and I especially appreciate that we have the clear quantitative ones as well as some of the qualitative ones as well, looking at what our partners think and staying informed in the loop as we make those decisions, and agree with, I appreciate the rationale for the 3-week window as well. I think it all looks good.
Maureen, we have not heard from you this evening. We got no volume, Maureen.
Okay. Yes, I'm barking again.
Yep, now we can hear you.
I really agree with what everybody has said with respect to institutional partners and the quality of the experts and the team that is here in that room or by Zoom is pretty amazing, because we've got a lot. One of the things is my questions really go probably more to Carol. Whether or not the Public Health Board is ever thinking about adapting their criteria to include some of the institutional partners or other factors that Moscow's thinking of doing. such that, our numbers may not be, we don't have as many hospitalizations, although they've increased, or deaths. But the answer is we have really strong institutional partners that are begging us. We use the word begging because that was in the letter, saying, could you please keep the mask going, because it helps keep our schools going. It helps our hospitals stay under control. And my fear is that if you look at us moving into a green zone, then it sends a certain message to the population that says we don't really need to be wearing masks. And some of that is, even though the governor had changed this to stage 3, it's not written in those. So, and I think that we've heard those, the support for our mask mandate for months now. And during that time, we were still in the green. And so I guess I'm trying to figure out how to work with our population, some of whom don't think that the masks work very well. And they take that, plus they take the green level at the public health level and kind of argue against us using masks.
Thank you, Maureen and Mr. Mayor, if I could respond.
Yes,
you are
please.
right, and I think our Board of Health is open to looking at different data sources and data metrics, combining and enlarging and improving what is already out there. So we will be looking at your new, whatever you choose to adopt, recommendations for data and seeing how we can help you with that, showing those data sets.
One of the things that was interesting is reading the letter from the doctors written to Governor Little and them saying we should have a statewide mandate. And so if we don't get our metrics pretty similar, that's going to be a really hard thing to get to impose.
Thank you, Maureen. Sandra, we have not heard from Sandra yet.
Thank you, Mr. Mayor. I appreciate that. I think we've had a lot of great information tonight. I hope folks in the audience are feeling like they're getting a little more info. One thing I'd like to ask, and it's probably more directed toward our Gritman friends, and that is we hear a lot, I hear a lot, yeah, things are kind of bad, but only had one death and people die. That's just a sad part of the world. People are going to die anyway. People are going to get sick anyway. People get the flu, they get other illnesses, they get pneumonia. Why are we so concerned about this? And then the second part of that question is, what is our hospital capacity right now and where are we going? So how do we fight all of this sickness? What is a good answer to give people with a question about bad things happen anyway and where are we at within our hospitals?
If I may answer.
Okay, Dr. Brown, thank you.
Sure. I think, first I'll just express a slight sympathy to that. There is, as none of us get out of this alive, and we do have to accept a certain amount of rational risk. People do that every day when they drive their vehicles, when they make decisions about wearing a helmet with their motorcycle, all that sort of thing. But on the side of doing masks and taking more measures with COVID, there's a couple of things to consider. One is that it, pretty much no matter what study you look at, it's 4 to 6 times more lethal than your seasonal flu. And so that's a significantly more dangerous illness than what we have every winter, every fall and winter with the flu. Second, as I indicated in my initial comments, there's very good data that shows that mask use decreases the incidence of fatal cases of this because it decreases the amount of virus that you're inoculated with when you are exposed. And that's been shown by numerous studies and experiences in Asia and in the cruise industry. And I invite people to look that up on the internet if they would like to see the data for themselves. And so the fact that we have low fatalities in Latock County, as I indicated in my initial comments, is very reasonable to lay at the feet of the mask policy that you all passed. And the fact that we're seeing a lot more lethality not very far away, so a very similar climate and similar population, suggests that the main difference is the mask use. And so, I know that none of these people want to see increased numbers of deaths among their neighbors, but I would ask them to have some patience with the fact that it's not looking as deadly as many people have advertised, in part because we've taken these reasonable precautions and whatnot. And I think for the second part of the question about hospital capacity, I'll let Connie or some of the others speak on that. But I'd ask you to also remember that it's not just the number of raw beds that we have, it's the people to man the equipment and to care for the sick people that are often the limiting factor for a hospital to care for folks. And so if half your hospital staff is out sick, it doesn't matter how many beds you have, you just don't have the personnel to care for folks. So I'll end my comments there.
Thank you, Dr. Brown. Connie, would you like to add to that, please?
Well, this is Kara. I'll try to answer some of that question and kind of reiterate a little bit what Dr. Brown said. So our newer wing, which is our 2004 wing, was built with 43 beds, so we could technically go up to 43 beds. So when we were at the beginning of the pandemic, we essentially took rooms that were out of service and put them back into service. Our challenge is from a staffing standpoint. We don't have staff for 43 beds. And so depending on how sick those patients are, it depends on really how much capacity we have for our community. And so we are monitoring that on a daily basis. Now that we are starting to see more COVID cases, we are starting to see some of our staff get exposed or have to be put into isolation. And so that's the challenges that we're starting to run into here at the hospital.
Thank you, Kara.
Welcome.
Well, let's see. Sandra, did that answer your
It did.
question?
Thank you very much. I appreciate that.
One of the things, I want to mention this to everybody because we got a fine panel in front of us. One of the things I tasked our city supervisor, Gary Riedner, with months ago is about setting up a journal as we go through this journey with COVID, because we had no blueprint in front of us, absolutely none. We were all kind of going by the seat of our pants in a way, really, and trying to do the best we could with what we had and trying to learn things on a day-by-day basis. And so we're putting a journal together just in case, in the event something like this happens 10 years, 20 years, 30 years down the road, somebody has got a roadmap to say, okay, this is what we did, this is what worked, this didn't work so well, so that somebody would have a blueprint kind of how to do things. And my guess is probably the medical community is going to put together the same thing in case Gritman runs into this, or the school district, or the university, because it's one of those, this is the first time in over a century we've had to all deal with this. And so we're kind of learning, and we got all this expertise, and so we need to get that journal put together so when we're done with this thing, it'll be kind of like a book. And it could be things called things we did right, things we did wrong, doesn't matter, so we can make improvements on it as we go along. Okay, I just wanted to make that statement. Okay, Maureen.
This question goes to Carol, and that is, if I heard Dr. Brown and Dr. Garrett correctly, it seems to me that, and maybe Connie as well, that we're not looking just at our own hospitalization and the rooms that we have here, but the availability of hospitalization outside in the broader area. So if someone needs a heart attack, and we don't usually take care of those, we usually send them up. If there's no spaces available up in Kootenai County or up in Spokane, does that factor into how long we keep our mask mandate going? That makes sense?
Was that
Thank
for
you,
Carol?
Okay. I'll start that, but I think Dr. Garrett even addressed this in his opening statements. It is about a regional approach and where capacity is, and maybe I'll just jump off there, Dr. Brown or Dr. Garrett. For you all in the time frame it takes to transfer patients if you need to, because at some point there are cases that have to be transferred out of Gritman, and then the capacity for our surrounding hospitals to take those patients. Is that correct, Dr. Brown?
Yes, that's correct. Dr. Garrett has the most immediate experience to that, and so I'll let him speak to that too. But yes, it's very critical that we be able to move our patients. We have that problem anyway. You get a big snowstorm in, we can't fly the helicopter. You often have to sit on a patient in our facility for a significant period of time until you can safely transport them. And so it's not a new problem, but having your facilities completely full dramatically limits your ability to care for all diseases. And, you know, if you need dialysis, if you need to see a specialist, if you need a cardiac cath, if you need an emergent surgery that we can't do here, well, those things just may end up being delayed. And delays can have very serious repercussions in the medical field, as you know. So with that, I'll just let Nick speak to it because he's working in the ER actively.
Okay, Dr. Garrett.
Thanks, Dr. Brown. Yeah, probably as an ER physician at a critical access hospital, we deal with lots of scary things some days, and some days it's kind of boring. But our single biggest fear is getting that patient that we cannot do anything for because we don't have the specialist or the machines or the robots or the procedural capacity to take care of that patient. And so as a small hospital, we have to look at our regional capacity as a whole, not just how many beds Grittman has. And from like Kara Best said, from a staffing perspective, that may be our single biggest limiter as this virus progresses and we see more of the community get sick, is that we are not immune. We don't live in a bubble and we don't, sleep at the hospital inside a negative pressure room. So we can always surge, we can put beds in tents, we can do all kinds of fancy things. It's not necessarily bed capacity, it's the human resources aspect of it. And so that is what we've been seeing as one of the single biggest stressors on the system right now, is not only our in-house capacity, but our ability to get patients where they need to go. We've seen patients in our local community between here and Pullman being sent to hospitals in Boise, being sent to hospitals on the west side near Seattle, Harborview, because we can't get those patients to our other closer facilities because they are at capacity. So that's one of our biggest fears from an emergency standpoint.
Thank you, Dr. Garrett. Maureen.
My question on that is whether or not, that makes perfect sense to me that the apprehension should be looked at regionally, but what impact does that have on a masking mandate? Is there any correlation between the concerns as well as the regional?
Carol, would you take that, please?
Go ahead, Dr. Brown.
Well, I'll be very brief. If it affects our ability to staff our hospital, if everybody's getting sick in our community because people are not masking, and we can't have nurses or janitors or food service people or physicians or anybody to man that place, then people will not get the care that they need. We'll have to ship them out. We won't be able to admit them here. And so it does have an immediate significant impact on our ability to care for people right now. There are some things that have to go out, and it's hard to say how a Moscow mask mandate would affect that. But there are also a large number of cases where we just can't handle the patients we're being asked to handle because we don't have the staffing, and that will only get worse if we have widespread community spread in our community. So I'll speak.
Thank you, Dr. Brown.
So my comment was that, yes, absolutely, the masks are keeping the people out of the hospital and saving those resources that are needed so greatly, so that the rest of us, because we may fall down and break a leg, or we may have a gallbladder attack, or we may need a heart, have some heart issues that go on, and we need to be admitted to the hospital also for general health, to maintain everyone's health and well-being. If we're not wearing masks and it's just the hospital is full of COVID people, the rest of us that need that hospital, we need Grittman to be there for our health concerns. We won't have a place to go because of the capacity that will be overwhelmed at the hospital. And that's public health's approach to why these masks are so critical, in order to save those resources at the hospital, protect them for the general population beyond COVID.
Thank you, Carol.
Saying something, because it's one of the arguments that, kind of like Sandra said, some people come back and say, well, we don't have that many people hospitalized, but the impact, it's kind of a domino effect. And I wanted to hear that not from me, but from professionals.
Well, we did in fact hear that from the professionals, Maureen. What they're saying is that you overwhelm.
which are climbing from the effects that have happened with COVID and the isolation that has gone on with that. The suicide rates that are amazingly holding pretty steady now, but the number of calls to the suicide hotline, the number of visits to the crisis center have just skyrocketed during all of this COVID time. And again, the more we can get people normalized back into our communities, which absolutely includes having a mask on, but at least being able to be out in the community, going to grocery stores with a mask on, being at least out and about, is absolutely helping the mental health, behavioral health issues that we've seen as unintended consequences of COVID.
Thank you, Carol. Well, we've,
I think Tony has something.
pardon me?
I think Tony was going to say something.
Tony, I'm sorry, go ahead, Tony. I'm trying to look at like 11 of you at once.
It's okay. Just in response to the great question. So we are isolating our students who live on campus in our own isolation facility. And we have up to 200 beds for that effort. And currently in use are 13 to give you an idea of where we're at on our capacity. I would go back and comment just quickly. One of the reasons why we're doing the asymptomatic testing is also to protect the hospital capacity. So by doing, and I will say that when we did the first large screening at the start of the semester, they were almost 99.99% asymptomatic. So clearly we were probably getting some people who were previous positives. We didn't test known previous positives after the first couple weeks when we got the system figured out. And when we did our second full retest, we did not retest previous positives. So to Dr. Brown's point and others about it's in your system for 3 months or more. We've done a lot to make sure we don't have false positives, especially as our testing has matured throughout the semester. And so, but going into our isolation and our quarantine facilities, and then to all the things Carol just said, when someone is going into isolation with us, they have immediate offering of food assistance. We're looking at mental health, making sure they wear masks, and we find ways for them to exercise. So that is all those things are important and part of well-being and are taken into consideration. You're hardly just put in a room and left to your own devices. So just can't say enough about how important mental health and personal care and all of that is. And the masks make all that possible. We've done a lot of contact tracing, and we have not traced it back to the classrooms where we have the hand sanitizer, we're wearing the masks, and places where social distancing is happening. We have traced it back to our rural surrounding communities where they don't mask. We have traced it back to members of the Moscow community who don't believe in wearing masks. So we are bar none about the efficacy of the masks and helping where spread, and doing our testing to, again, help do our part to not put a strain on the hospital resources so that they're available for the community when needed.
Thank you, Tony. That was a good answer. Well, we've been at it for about an hour and a half. Folks, how would the council like to proceed?
Well, from my point of view, I think the metrics that we've established are as good as we can get right now, realizing that things may change in the future. But for right now, I think it's probably as good as we can manage. And using those 3 metrics, plus having the time frame of 3 weeks involved, plus working up some similar metrics for Whitman County, because the border is porous and viruses don't care. And when people come across to go shopping over here at Winco or something, things can happen. So I think those things, the current metrics we proposed, 3-week in the green zone for all of those metrics, and then incorporate Whitman County, I think is the light at the end of the tunnel for doing away with the mask mandate. If we can accomplish all of that in that time period, I think we can begin to look at removing the mandate, but until that time, I think we have to maintain it.
Art, did you also mean to add the 3 points that Gary listed in his memo, including the governor's determination, the recommendation of public health, and the review of recommendations of our institutional partners. Did you include those? Did you mean to include those in your statement?
Yeah, those would work too. I think the main points were the ones I mentioned, but those are good adjuncts. The governors, from a political point of view, input from the medical community for sure, because we aren't medical people and we value their input. They're the ones who need to guide us.
Art, you put in a motion.
Oh, sure.
I'll
Maureen?
second that one.
Okay, Gina, second that. Gary, did you get that? Gary?
Yes, sir.
Okay, and what that boils down to is the recommendation to approve the protocols for evaluation of all those different things that we discussed this evening. Does that sound good to everybody? Is that fair? Okay. With that, I'm going to start the roll. Brandy?
Aye.
Maureen?
Aye.
Ann?
Aye.
Gina?
Aye.
Sandra?
Aye.
And Art?
Aye.
Okay, Gary, we got a direction moving forward. I want to thank the panel of experts that we have, and thank you so much for the collaboration and hard work that everybody's done, University of Idaho. I'd kiss you, Tony, if I could, but I got my mask on, so we better wait for that to happen. But you guys have been outstanding. Moscow School District, our partners at Gritman, always terrific. Carol, your fine work that you do for us. And of course, our county commissioner. So we're all working together on this thing. And that actually is the end of our meeting tonight, ladies and gentlemen. But a huge appreciation to Dr. Brown and Dr. Garrett. You guys are right into the heat of things, especially Dr. Garrett. Hope that I don't have to see you sometime in the emergency room, but you never know, you know. So we appreciate what you folks are doing. So with that, I would entertain a motion to adjourn.
Let's rock.
Second, all in favor, say aye.
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 Okay, folks, we're adjourned at 7:28. Thank you all very, very much.